everyone, and welcome to our live fireside chat. Today, we're talking about addiction treatment and domestic violence. So, do us a favor and help us lift up this message by sharing. So, if you're watching us from LinkedIn or from YouTube or Facebook, do us a favor and just share this message out. Our job and our role is to bring you content that matters to you, that helps to uplift you. We want to make sure we get this message out to as many people. Today, we have Samson with us. He's going to be talking to us about his expertise in the field of addiction treatment. You're going to want to stay to the end. This information is groundbreaking. There are some new interventions and new uh, things he's been working on for the last almost 10 years that he'll be sharing on this fireside chat. And of course, we want to make sure you get that information. So, whether you are a parent or an educator, or you are in the industry, or if you're a pastor, we definitely want to make sure you are informed and that we're raising awareness. And we definitely appreciate you all for tuning in with us. Samson, thank you so much for joining us today. Welcome to Fireside Chat.
Thank you so much for having me, Miss Moore. I really appreciate it. I'm looking forward to our discussion.
Same. Well, I definitely want to start with reading your bio. Samson, you've been, you just told me that you were at a conference not too long ago. I think it was the NADIC concert, speaking on addiction and the need for therapists and counselors so that we're addressing the holistic needs of individuals that are in recovery. And you've been doing this work for so long. And I think just your just how you got into it is extraordinary. But I want to first read your bio and then we'll jump into some questions. How's that sound?
Sounds good.
Amazing. All right. So Samson is the vice president of clinical services for the behavioral health group. He is an accomplished leader with a history of driving organizational results with learning and development solutions. Excuse me. He's also a leader in the field of addiction treatment for over 12 years. He was formerly the director of training and professional development for NADIC, which is the National Director of Learning and Development for the Phoenix House Foundation. He's also a certified lead trainer for the cognitive behavioral interventions for substance use abuse curriculum, Calm Every Storm, crisis prevention, and intervention. And he is an industry expert in implementing evidence-based programs and practices in substance use disorder treatment programs. And if I may also add, he's also a speaker. He travels around speaking about these issues and raising awareness. So again, thank you, Samson. If there's anything that I left out, please feel free to jump in.
No, that was a good recap. I'd love to talk more about the issue than myself. So hearing that bio always makes me feel nervous. I'm like, oh, did I do all that? But yeah, thank you so much for having me. I'm looking forward to jumping right in.
Of course, and that's when you know you're passionate about the work, when you're just ready to give the information. So, in talking about the topic of passion, what inspired you into this work? When you're even though you're not working directly with clients, you're working in the area of addiction and treatment. What was it that inspired you into this work?
Yeah, honestly, I would say so. So I started in this field very, very young. I started in the helping profession, as I call it, as a pastor.
Yeah,
I wanted to help. And I felt called to help. I felt called to help people in pain because I saw a lot of pain growing up.
yeah,
I was born and raised in College Park, Georgia, in the 80s and 90s when gang warfare was rampant and well known as a daily incident down the street, off Old National Highway. We just got used to it and got numb
right.
to a variety of traumatic experiences. And so even when I became a pastor, I saw a lot of those experiences in people's home.
Mhm.
And I realized I didn't understand the science of helping, that there is a way to care. And we often feel passionate about caring for someone in a raw way,
Mhm.
but there are techniques and strategies, and so then I got almost obsessed about evidence-based practices and programs and what research has shown to be the most effective means and method of caring for really complex mental health and substance use disorders. And so that's where my passion started. That's where it still is today.
That's incredible. You talked about your own experience, but I think typically there is a correlation between what you've seen growing up and the call into this work is, I think there essentially is a call, whether you're, Christian based or not, to be in this work. It's purposeful work. It's work
Mhm.
that requires a connection to your reason of existence. And it sounds like that was it for you. Being a pastor also allowed you to realize that the people that you were helping in that way needed some more specific strategic help. Um, and that obsession you talk about, I think, is it really is passion for what you do. So I love the fact that your trajectory has been the one that it is.
Yeah.
Um, so you talked about the strategies to helping and the science of help. Can you talk a little bit about the role that trauma plays in addiction in general? What have you seen in your work?
Yeah, so there's a lot of thought about the chicken or the egg. What came first, the trauma or PTSD or trauma related symptom or the substance use? And honestly, it often doesn't matter because there's a root cause myth that if you find the root cause of the trauma, then maybe it will resolve or it will heal the substance use, which isn't the case. And so it can happen either way. There are people who, because of their habit sort of evolving into an addiction that also evolves into some sort of violence or aggression or uncontrolled behaviors, that they enter into traumatic experiences. And so the trauma can happen after the addiction. And then there are also people who get confronted or experience traumatic events. And as a part of their trauma response, they use substances to numb or cure or erase that pain, which is only temporary and rarely works, right? But that also forms a habit and an addiction. So one or the other could come first, but they often interact. About 72 to 80% of our patients who have a diagnosed substance use disorder also have trauma-related conditions.
Wow, that's a huge number. Um, and what are some of the? I know you talk about strategies and you talk about this connection that you also have to or commitment that you have to evidence-based interventions. What are some of those strategies that you've been seeing that really works for those that have dealt with addiction or that's dealing with it, or on their journey to recovery?
Yeah, well, so it's always important to assess where someone is on their road to recovery, on their path, and how their symptoms are interacting. Because you could work with 10 different patients who are dealing with that same co-occurring issue, and they
Mhm.
could have 10 very different experiences right in front of you. So for example, the your normal capacity, your instinct as a human who wants to help when someone is feeling triggered or traumatized is to help them relax, right?
Right.
And we all do it. We all say, even to our kids, hey, relax, calm down.
Mhm.
But we don't notice that the language with relax or calm down carries a very controlling tone. And we could actually be triggering someone based on their trauma response by
Mhm.
telling them to relax or to calm down. And we are triggering a controlling symptom or a controlling issue that they're struggling with.
Right.
So seeking safety is an evidence-based practice that is really well known and used for people with PTSD and substance use disorders. And in seeking safety, they use a completely different strategy. Instead of relaxation techniques, they instead use what's called grounding techniques,
Well,
which is the opposite direction. It's about promoting awareness of where you are right now so that you can kind of separate yourself from that memory or that hyperarousal thought that is sending you to an unsafe place, and you
mhm.
can draw yourself to a current moment. Um, and so
Incredible.
grounding techniques can be anything like distraction. Tell me your top 5 favorite shows. Tell
Right.
me 4 sports players that you really admire.
Yeah.
Grab your chair and describe to me what it feels like. What's the temperature? And so that distracts someone, but you wouldn't know that instinctively if you didn't understand the science of the technique and how to assess where someone is.
Yeah.
So that's an example of kind of where we would normally be drawn to versus what we see really works for that stage of recovery.
I think that's so incredible. Like just the how thinking about how some of our evidence-based models and the past may have been triggering and almost perpetuating the symptoms rather than dealing with them and helping people on their journey to recovery, and how some counselors may not even realize, or therapists, or maybe just family members may not realize that they are the trigger to this person, or their words may be triggering. And so I love that, it's almost reverse. So when you tell someone to calm down, sometimes it can heighten, right, their senses, and almost create this sense of not feeling safe.
Mhm.
And so, or even exposure, or, or agitation, or whatever it is, and they may need to find just something to cope with in that moment. So I love that new model where you're grounding, or you're teaching them how to be in the present, how to be essentially be in control. Because when you're able to sort of ground yourself in the moment and feel and breathe and realize you are in control of that moment, it actually does to bring your levels down, and helps you to relax. So I love that you mentioned that. I think that's helping even me as a mom. So
Yeah, and can I add one more piece to that? So
like,
whenever I talk about evidence-based programs and practices, and, seeking safety models like that, if you're a counselor listening and you've been in the field, let's say in the last 5 years or so, you yourself may be triggered because you've seen heavy dominance on curriculum-driven approaches, and approaches that are very technical and almost Eurocentric in their build.
right.
And so what I would say is to make sure to combine all of what's evidence-based, not just the curriculum, but also the fact that Medicaid and Medicare, by the way, when they do an audit of your records and your charts, they're not just looking for those traditional evidence-based strategies. They're also looking if your care is individualized to the person.
Incredible.
They will even write on audit findings, this treatment plan doesn't look individualized.
Wow.
What that looks like is if a patient comes in and shares that one of their strengths or something they've done in the past was art, was drawing, was music, and you're not incorporating music and art
Mhm.
to their therapy, then you're missing something. So in the same way, when you're pushing evidence-based practices like that, it is also evidence-based to make sure to implement their own strengths so they can reconnect with their authentic self. When you're helping someone, that's what you're trying to do. You're trying to help them find who they are authentically, and that may include what they used to do before that trauma occurred, which
Right.
maybe something that could be healing and curative in and of itself to
Yeah.
reconnect with art, with expressive arts, with drama, with play, with anything that is a part of their authentic self, and incorporating that into their recovery and their treatment plan is just as vital.
I love that. There are like three thoughts floating in my mind, Samson, as you as per your last statement, and that is these competing ideologies of evidence-based versus authenticity versus customization, and how do you sort of bring the three together, and integrate the three together? Because I do believe they should complement one another, and it shouldn't be one versus the other. But I think there is a legitimate struggle to essentially provide an evidence-based model, excuse me, while also customizing it in a way that's authentic to the client.
Mhm. Yeah, and it really what it comes down to is you're trying to help somebody find their voice. It's Domestic Violence Awareness Month, right? And we're trying to draw awareness to a really what used to be a very taboo pain, and something we're trying to build more awareness to. But
Absolutely.
someone who reports or expresses feeling oppressed, yes, they need a plan and the techniques and strategies to find their way, but they also need to be able to express. Oppression and expression kind of have a little bit of a counterbalance, right? Their voice was pushed down for a long time. Their voice was not heard. They didn't feel seen. And so how can you, in counseling and therapy in your work, help them feel seen and help promote their expression? And that's often done in a very, very simple way by promoting arts, expressive arts, and drama and music. So that's what I always say is if there's a report of oppression, make sure you bring a strategy of expression into your work.
It's incredible, Samson. I'm gonna invite you to our next staff meeting to talk with our therapist about this. But no, that's incredible. If there's been oppression, there must be some strategies of expression. Amazing. No, we did, as mentioned, this is Domestic Violence Awareness Month, and I know that your specialty is in addiction treatment. But prior to going live, we sort of chatted about the correlation between the two, between addiction and domestic abuse. I'm wondering if you can speak to the correlation or any research that you have on that.
Yeah. So, first I'll share this. So, I have to tell you, I was very impressed and impacted when I looked online and I saw this Walk a Mile in Her Shoes campaign. Now, I don't know if you guys have seen this, but this is a really large group of men, congressmen, senators, sports players, police officers, construction workers, counselors, and all these men are on this campaign, Walk a Mile in Her Shoes, to draw awareness to domestic violence. They're walking in red high heels. Now, let me tell you something. You're not going to see me in that video because my ankles will be destroyed. I mean, I'll be in the hospital for the next 2 months, working on my ankles, right? And so, but these dudes did it, right? These brothers were doing it. They were out there walking that mile in her shoes in red high
Wow.
heels to draw awareness to because and here's the problem, because
Brand awareness.
because it does impact women significantly more than men. However, domestic violence is not a gender-based issue, right? It can impact everyone. During the height of the COVID-19 global pandemic, there was an 82% increase of domestic violence cases. When compared to other minority communities in the United States, Black women experience multiple types of victimization at much higher rates. Only 34% of people who are injured by intimate partners actually receive medical care for their injuries. So, as much awareness as we're trying to draw, there still is a lot of suffering in silence. And that suffering in silence, that theme, is one of many themes that connects between addiction and domestic violence.
Yeah. No, Samson, those are shocking statistics. And, you know, the fact that only 34%, I think you said, is the number that actually seeks treatment. That's a large number of people that may need medical treatment that are not speaking up.
That's
They're
right.
you talked about the silence that most of the time in domestic violence, people that are in domestic violence relationships um, tend to be silenced. There tends to be a suffering and silence. And you talked about some of the themes that may cause this. And I'm hoping that you can go into that. When you're in a domestic violence relationship, you may feel like it's your fault,
Mhm,
or
mhm.
people don't believe you, and or there's a sense of embarrassment of how can I get myself into this, or I never thought I would be in this type of situation. But I'm hoping you can talk about those four themes, which is the parallel between addiction and domestic violence.
Yeah, yeah. There's such a big parallel. I mean, there has been for a long time. So the National Council Against Domestic Violence and the American Society of Addiction Medicine have documented pretty steadily over the last 8 years that substance abuse is involved in about 40 to 60% of all intimate partner violence incidents. And that domestic abuse victims are 70% more likely to drink excessive amounts of alcohol than those of healthy relationships. Some of the themes that you see that are parallel, now we talked about secrecy and shame, but there's also issues of control. Because domestic violence is less about gender, it's a lot more about power and control, which is why you see that 1 in 9 men actually in the U.S. Experience domestic violence, and that's only what's reported. However, 1 in 4 women experience domestic violence. Now, my passion, of course, is in studying and supporting those in recovery from substance use disorders and common co-occurrences. Like I said, I'm not an expert on domestic violence, but I am committed to being a student, which I hope we can all do. I want to recommend one book written by a true pioneer who spoke on Red Table Talk about domestic violence in 2022. Her name is Dr. Carolyn West. She's the professor she's a professor in the University of Washington. She wrote a book called Violence in the Lives of Black Women, Battered, Black, and Blue. So in that book, I've learned a lot, and I learned a lot about the signs we have to look for. And by the way, the signs is another area that kind of connects between the two. As community members, as friends, as family, we all really need open community discussions about addiction, recovery, domestic violence, and trauma. We need training on these topics. I've been really impressed by the small number of community events, public libraries, meetup groups, churches who are starting to invite experts on historically taboo topics. I really do believe that every church in America today should share the stage more often. I would say share the stage once a quarter at least, to bring in someone on human trafficking, to talk about the signs and symptoms of what to look for, to bring in someone about intimate partner violence, to talk about it, so that there's not this lingering phrase that we all hear: was done in this house stays in this house. It's so damaging, right? It keeps this cycle of violence fueled and covered. And so the other two themes are denial. Very often you see those who are experiencing domestic violence wrestling with denial, and it's not because they're dishonest. That is a really common misinterpretation. It's because they don't understand how to confront what's happening to them. It's like the shock phase that you deal with in grief. That symptom of denial is more about shock and less about honesty. How do they confront the reality of something that's happening that shouldn't be real? It is that painful, right? And so I think trying to understand the denial phase of those with domestic violence and those with substance use disorder really helps us to engage those low engaged people, those who are kind of almost evading help and saying, no, 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 I don't need help. And we can do that. We can do that in so many ways, right? Some of it is by knowing what not to say. Like I always don't say, what did you do? Don't say, well, why didn't you leave? If it was really that bad, you would have just left, right?
Right.
So there's certain things we say that perpetuate the harm.
Absolutely.
There's just pray over it. He loves you. If he didn't love you, he wouldn't do these things. Oh,
Yeah.
he's just going through some things because of unemployment. He's
Right.
just going through some things because his daddy drank, and so he's drinking, and he'll get better. He'll get better.
Right.
There's all these statements that we perpetuate that
Absolutely.
fuel the cycle of violence, and it keeps the victims feeling trapped and feeling almost more shame. Which, by the way, in and of itself, domestic violence breeds shame, right? Um, so okay, let me stop there. I know I'm going off, Miss Moore. I'm sorry.
Oh, no, that was excellent, and I do apologize for falling off at some more network issues, but the part that I caught was extremely, it hit very hard, because I think you're dissecting and deconstructing a lot of the cultural stigmas that we have perpetuated, mainly in communities of color,
Mhm.
that's prevented us from seeking and getting the help that we need. We can go into like churches. I heard you mentioning parts of that. Sometimes the stigma may be, well, it's your husband, submit to him, in the middle of
Yeah.
being abused. Um, and so these are, I think, things that have kept us from seeking treatment, from stopping this cycle that's so vicious. And again, like you mentioned, it does perpetuate the shame, because if you believe it's your fault or something wrong with you, or you're not having enough faith or whatever it might be, then you're less likely to leave out of the relationship or the situation, or B, seek advice or support. And so
That's
I'm
exactly
wondering.
right, Miss Moore. Here's what I say a lot to pastoral leaders and community leaders. You don't have to be an expert on everything. It's okay. It's okay. It does require a little bit of humility to share the stage and to say, you know what, as a pastor, I know a lot, but I'm not an expert on
Yes.
domestic violence, and I'm okay with that. Let me bring someone in who can help make these community members safe, because here's what's not going to change in our culture. We are hardwired to connect. So we are going to gravitate towards community. And,
Absolutely.
and, and traditionally, we're going to gravitate towards community where our moms and our dads and our grandmas, where
Sure.
they gravitated to. So that may be the church, it may be another community group. But when we do, that stage has to be shared with experts who can maintain safety in that community and call out things that we may not be aware of that are being perpetuated, right?
Absolutely. And I think you hit it, humility to share the stage, because it doesn't take away from your role, but it only undergirds it. To call on the experts that do this work and are, experienced in his work. And I think, when we think about, and don't make me to make this about specifically about church, but we know that this is where we see the most issues,
Hmm.
where
Hmm.
people come with everything, all of the, as you would say, dirty laundry is aired out here. But I think a lot of times it may stop there because there isn't that sharing of the stage with other agencies or experts that might even be in your congregation,
That's right.
that you might be able to pull on and to, or building a team. I think that was something you mentioned on the podcast when you were a guest on the ATO Rise podcast,
Hmm.
potentially building a team that is um, responsible for this type of work.
Yep, that's right. Yeah, yeah. And those are all great, the great tips and tools to share that and to promote safety in your congregation, in your community, in your group, in your family. At Behavioral Health Group, we're known in our communities to be that one treatment provider that will see anyone and everyone, and we do use methadone. We promote and make sure that patients are taking medication that helps them stay safe, so that because there's such a high potency of drugs that are out there right now, that a return to use or a relapse can immediately become an overdose, right? So it's not the same anymore where you can say, oh, they had a slip, let's bring them back. And yes, that's important,
Yeah.
but we're talking about saving lives by using medication that helps to balance withdrawal symptoms, right? And then connecting them with counseling that keeps them engaged with recovery and sends them along the path of recovery. So what I will add to that, another group of experts, is the National Domestic Violence Hotline. It
Okay.
is 1-800-799-7233. 1-800-799-7233. This is a free nonprofit domestic violence hotline that gets 20 to 30,000 calls a day. So you are not alone, even though it feels like that. You are not alone. And by the way, some of those calls come from concerned family members to figure out what to do. Um, it's offered 24/7. Oh, thank you for typing that in there. They're offered 24/7 in English and Spanish. They have close to 200 other languages that use interpretation services. Even if you don't want to call and you want to kind of maintain more anonymity, which, by the way, it is an anonymous hotline, you can text START to 88788. You could text START to 88788. So this is how you get on a path to building a plan, because you do need a plan. You can't just push someone to leave a domestic violence situation, because that can quickly turn into domestic homicide, and that is definitely not where we want someone to be. And so even when someone is in treatment or recovery for substance use disorders at BHG, we are really clear to build a plan that's around safety, not escape. And I know that's hard to understand because we all think escape is safety. No, the moment a perpetrator feels like they're losing control, that can shift really quickly into
Absolutely.
homicidal intentions. And so it's important to keep
Absolutely.
people safe and to wrap their plan around safety, which professionals at Behavioral Health Group or the National Domestic Violence Hotline can help you with. Um, oh,
Excellent.
nice. Y'all got it up there. Thank you. Yes, the number up there. Thank you.
It's there, Samson. This has been incredible. You've given us so much information, so many resources to really help us, whether we are a concerned family member or one of our loved ones might be in this, or whether it's ourselves or whether we're from a community group or organization or a church. You really have covered almost every end. And so I just want to thank you for that. If there are specifically loved ones that are concerned about whether it's their own children or relatives, what would you advise them in terms of any tips or strategies as we're coming to a close?
Yeah, I mean, definitely start with, these expert hotlines, right? And get more information from the experts. But you can immediately start by asking, are you safe? Do you need someone to talk to? Do you
Excellent.
know that I'm someone you can talk to? And
Very
of
good.
course, maintain a non-judgmental stance. Avoid drawing any conclusions, right? Because you're going to want to jump to a conclusion and immediately give advice that you
Yeah,
still may not have enough information on, right? But
correct.
ask, are they safe? Do they need someone to talk to? Do they know that they can talk to me, that I'm there for them? Explain to them that there is free confidential help available, that they don't have to go through it alone. Explain to them how important a safety plan is about this kind of situation that is really attacking their safety. Being aware of red flags. Red flags is if you notice someone is extremely jealous, possessive, and even unpredictable, especially in considerations of their partner, being around other people, right? These are typical signs of very unhealthy control.
Excellent. Very, very good. And just to recap, so loved ones, family members, pastors, community groups, and organizations. These are some tips that you can take away with you. Number one, non judgmental. And I think that is a challenge, but do not judge the person or the situation. Remain as neutral and non judgmental as you can. You want to have a supportive stance for that person. Remind that person that you're there for them. And that you are someone that they can speak to.
Yes.
And then always prioritize that person's safety. So don't jump to conclusions or judge the situation, but prioritize the safety of the individual and safety planning with that person. I think that, again, we can utilize these techniques, then we can really drive up the numbers of people that are getting support and the help that they need in these situations. So, Samson, thank you so much for the information. If people want to reach out to you or are interested in your work or maybe asking you to speak on their platforms, how could they do that?
Yeah, you can connect by going to bhcrecovery.com, or you can find me on LinkedIn just by entering my name, Samson Teclamarium. I don't think there's too many people with my name, but if you find some, hopefully you know what I look like. But you'll also find me on bhcrecovery.com. We've got a lot of information there about how to help your loved ones and how to get help if you are someone who's ready, to get help. So yeah.
Very good. Excellent. Well, thank you so much, Samson. And
Thank
thank
you,
you
Ms.
all
Miller.
for tuning in, for watching. I know this is a very, very heavy subject, very sensitive subject, but it's necessary. And, we have the expert here, Samson. So please reach out to him or to his group, bhgrecovery.com. And if we can get his name on the screen, if you're interested in reaching out to him directly, please find him on LinkedIn and connect with him directly. We don't specialize in this work at iRaise, but he is an expert and his group is an expert or experts in this work. So we want to make sure that you get the help and the resources that you need to save lives. So thank you again, Samson. Any last words before we are closing?
No. Thank you so much for the time. I'm honored to share more and to talk with anyone about this. So yeah.
Thank you so much. Thank you, Samson. Thank you all for tuning in and for watching. Again, please don't forget to share this message. If you're watching this later, we still want you to share. We still want to hear your thoughts. So don't be afraid to comment. If you are someone that is in a life-threatening situation involving domestic violence, we can get that number back up on the line, on the screen, the hotline number. Please reach out to the National Domestic Violence Hotline. Please don't isolate yourself. Talk to someone that you trust, but do not remain silent. Your life matters, and what you're going through matters, and you're not in it alone. Again, thank you all so much for tuning in. Please don't forget to follow us on all social media platforms at iRaise.org to stay updated on any of our latest events, programs, and shows. We appreciate you all so much. And again, lastly, don't forget to subscribe to our Elevate podcast on all major platforms. We have a new episode that's being released tomorrow. So please subscribe as soon as possible. We're still dealing with these issues on our podcast. And so again, thank you so much. We appreciate you all. Reach out if you need support. We love you all, and please stay tuned.